Welcome, everybody. Congratulations for making it here today. Thank you so much for showing up for yourself, learning more about nutrition, learning more about how to prevent and maybe even potentially reverse symptoms associated or potential to develop autoimmune conditions here at the Create Cures Foundation. Hello, everybody. Yay, it looks like the chat box is open. Here at the Create Cures Foundation, we are very passionate, excited about implementing all of the latest and greatest research to help you. So today we're going to be engaging a lot with you using our chat box feature on Zoom here. So please have that chat box open. And at the end, we're going to answer as many questions as we can using the Q&A feature. So two separate things, the chat box and the Q&A feature. If you have a question, please ask in the Q&A feature so it doesn't get lost in the chat box, and make sure that you have your chat box open. All right, welcome everybody. I'm so excited that you're here.
All right, welcome everyone. My name is Frida. I'm one of the RDs at Create Cures Foundation here in Santa Monica at the foundation founded by Dr. Walter Longo. I did both my undergraduate degree and master's in nutrition, and it was really during my master's that I became very fascinated by nutrition interventions that mimic the effects of fasting. So when I graduated, I continued my education in a clinical nutrition PhD program, and one of the clinical trials that I am now the study dietitian and the research coordinator for has to do with an autoimmune condition, which we're going to talk a lot about today. And I'm very interested in how nutrition affects our immune system and how it influences all these symptoms associated with these conditions that are very prevalent that we will see, especially here in the Western world.
Thank you, Frida. I'm also a registered dietitian with Dr. Longo's Create Cures Foundation. I was inspired back in high school by a plant-based eatery to, oh my goodness, if you're going to be eating all of this healthy plant-based foods, I was meeting people working at this eatery that said to me, oh my gosh, I used to have all of these medications that I needed. I used to have all of these different diseases like diabetes and arthritis. And since I've started to eat healthier, I have reduced my symptoms and I don't need my diabetes medication anymore. And in high school, that really inspired me to become a dietitian. And I double majored in dietetics, nutrition, fitness, and health at Purdue University. And I ended up doing my master's thesis on plant-based nutrition and cancer, which allowed me to work at the innovative, incredible clinic, the Create Cures Foundation, where, as I said before, we get to take the best research out there, the most recent research out there, and truly get to implement that into practice in a clinical setting outpatient, which is really exciting.
Thank you, Katie. And in addition to Katie and myself, we also have a couple of other dietitians on our team. Kimberly, she's not here today, but she also has a lot of patients with different types of autoimmune conditions. And then we also have a new dietitian on our team, Jessica Harrison, and I will have her introduce herself.
Thank you, Frida, and hi, everyone. I just wanted to take a moment to introduce myself. As Frida mentioned, I recently joined the Create Cures Foundation. I'm also a registered dietitian, and I'm seeing patients both virtually and out of the Santa Monica clinic. I am so excited about tonight's topic on autoimmune disease because I personally have dealt with managing my symptoms of my own autoimmune diseases through lifestyle and diet interventions, which are extremely powerful, and both Katie and Frida will go into today. I was so inspired by my own personal health journey that I got my master's at USC studying nutrition, health span, and longevity, and studying underneath Dr. Longo. You'll see that the webinar tonight takes a comprehensive approach and considers so many different factors ranging from lifestyle and diet, and this is very similar to the approach that we take at the clinic, personalizing our recommendations and protocol based on each disease and condition.
Yay, thank you so much, Jessica. We're so excited to have you. If you all out there have not yet subscribed to our YouTube channel, our YouTube channel is amazing. We have all of our webinars, our past webinars from this series on there. So we have one going over the longevity diet, I know we get all these questions about protein, fasting, heart health. Please do subscribe to that YouTube channel.
Yes, and then we also had another 2 webinars on diabetes as well as cancer. So feel free to go on our YouTube channel and also share it with a friend.
Yes. And make sure to take advantage, 30% off of an initial consultation with one of our dietitians at the Create Cures Foundation using code autoimmunity2022. Go to the clinic.createcures.org to use this promotion, and it expires in about a month, November 26th. And there are continuing education credits, or if you're just interested in learning more about the longevity diet, we have a masterclass that's on sale now, and there's no code necessary. Just go to the website, education.createcures.org, and we hope you take advantage of these promotions we have going on. Okay, opening up your chat box. Before we begin, there are so many different autoimmune conditions out there. I'm curious to hear what ones that you might be more interested in learning more about. If you could please open up your chat box and let us know. Hashimoto's, a few people. Ulcerative colitis. Yes, my parents said ulcerative colitis. My sister has ulcerative colitis. Graves' disease, arthritis, fibromyalgia. Oh my goodness, there's so many, right? Lupus, asthma. So today we are for sure, type 1 diabetes. We're for sure going to be talking about the top ones like arthritis. Hashimoto seems to be a really big one, right? Thyroid health is so interesting. We're going to be hitting on a lot of these, as well as just taking a look at the immune system as a whole. And with that, we're going to be able to, hopefully help a majority of these symptoms that you're experiencing or that you're looking to learn more about.
Yeah, I'm excited to see all the different conditions you're interested to learning about, because we will definitely touch on a lot of these autoimmune conditions. So first of all, we'll talk a lot about what the immune system is. We're going to talk about different types of autoimmune conditions, as well as a little bit about their mechanisms. Of course, our microbiome, we know that in our gut, a big part of our immune system is located, our immune cells. And we're going to talk about how nutrition relates to this, as well as the longevity diet and a lot of recommendations. And of course, our famous quiz time at the end.
Yes. Some statistics around autoimmune conditions. Did you know that the prevalence of autoimmunity is increasing a lot? So there are over 100 chronic debilitating autoimmune conditions. And in the US, the anti-nuclear antibodies, which is the most common biomarker of autoimmunity, has been shown to really be significantly increasing. As you can see in this image right here, this is an image of those anti-nuclear antibodies being light up. And if you see on this graph here, period 1, these are different time periods in different colors. And the prevalence of these antibodies has just absolutely skyrocketed as time goes on in all age groups, and are really drastically in ages 12 through 19. So this is something that is really important to get a grasp on holistically. For example, arthritis is one of the most common autoimmune conditions. About 1 in 4 US adults have been diagnosed.
All right. So first of all, I want to talk a little bit about what our immune system is. So the statistics that Katie was mentioning really reflect how prevalent autoimmune conditions are. Our immune system is a very complex network of cells, of tissues and organs, and all the substances that really protect us from disease and infection by attacking these germs, such as viruses and bacteria. And the immune system recognizes that these germs are not a part of us and therefore destroy them. So that's what's happening in a healthy immune system. However, if you have an autoimmune disease, your body will attack the healthy cells of your body because it thinks it's a foreign substance, such as a germ. So we also have 2 immune systems. We have our innate immune system as well as our adaptive immune system. So our innate immune system is the first line of defense against pathogens. So think of physical barriers such as our skin, We have chemicals in our mucus, in our stomach, acid as well. But when the pathogens get past this protection by the innate immune system, that's when our adaptive immune system takes over. So all these cells in the immune system are originally created in the bone marrow from a starting cell. This is called what's called a stem cell. And then these stem cells will later develop into specific cell types. And some of these stem cells will become a type of immune system cell called lymphocyte. And we have two different types of lymphocytes, which are B and T cells in our adaptive immune systems. And these white blood cells play a very critical role in keeping us healthy. So the B cells mature in the bone marrow for B bone, and then the cells that eventually become T cells travel from the bone marrow to the thymus. So that's where the T cell come from, the thymus, which is located behind the breastbone. And so the T cells, the role is to protect us from the infection. In our daily lives, we're constantly exposed to a lot of pathogens, but because we have these T cells, this exposure does not become a life-threatening experience because we have these T cells to protect us. And then we have the B cells that are creating the antibodies, which are a type of protein, and these antibodies are binding to the pathogens to really neutralize them. So for example, an antibody will bind to a virus, and that's why the virus will be prevented to entering the normal cell and cause the infection. But in an autoimmune conditions, all these antibodies that are the T cells are attacking your healthy cells because it thinks that these tissues, your healthy tissues and organs, are a threat to the immune system. So there's something going on there that we will go over. So on the next slide here, we actually have more than 80 types of autoimmune conditions. There's so many different ones. The incidence of autoimmune diseases are increasing worldwide, and research really shows that our environment rather than genetics is really the driving force to this increase in autoimmune conditions. And I actually think that's a good thing because the genetics we are more or less stuck with. However, the environment, there's so many factors we can control and manipulate through lifestyle and nutrition. So some of the most common autoimmune conditions we have arthritis. It's really affecting the bones. We have multiple sclerosis, which affects our nervous system. We have inflammatory bowel disease, which are affecting our gut. Type 1 diabetes related to our endocrine system. We have lupus that are affecting a lot of different organs, the skin, joints, kidney, heart, lungs. Fibromyalgia is a widespread muscle pain and a lot of tenderness in the body. Psoriasis is affecting our skin. We have Hashimoto's, where the immune system is attacking our thyroid cells. Celiac disease, a very big one within nutrition, is affecting the small intestine in our gut. And the only treatment is actually a strict gluten-free diet. So the person needs to, that's the only treatment, avoid anything that has gluten in it. So that's also why nutrition education is very important. And then we also have other, other autoimmune conditions, but these are some of the main ones. So what is really the connection between autoimmunity and nutrition? So as I mentioned, most of our immune cells are actually in our gut. So the incidence of autoimmunity is also increasing in the Western world. And when researchers are looking at the reason behind this, it could definitely be related to that. At the same time we saw this increase was also during the time where the Western world took a Western dietary pattern, a diet that is very high in inflammatory foods. So on this picture here, I think this picture here of an intestine, it's very descriptive. This is taken from a study that was published in Nutrients, a great journal by Masuka and others. We see here on the left side how a Western diet versus the Mediterranean diet impacts our gut microbiome, the homeostasis, and the intestinal integrity. So we see on the left side that a leaky, like a Western diet consisting of a lot of processed food, high in sugar, high in salt, a lot of different chemicals, it causes both local inflammation here in the intestine as well as systemic inflammation in other organs as well. But then we see and this is what's called dysbiosis, a dysregulation of the integrity of the gut, whereas on the right side, we see a Mediterranean diet, which consists of whole foods, mainly plants, a lot of different nutrients that Katie are gonna go over later tonight. And we see there's a very great balance between the gut. And then we also see here between this, or in the gut here, we have something called tight junction and gut tight junction. And normally in a healthy gut, these spaces are spaced out with a specific space. It needs to be very close to each other because the nutrients are flowing in and out in a very like synergic manner. However, if there's inflammation and this gap widens, things can flow through the gut, which are not supposed to go through there, like bigger amounts of protein and certain substances, which can cause a lot of toxic and inflammation in other organs. And this is what's called leaky gut. And research has really shown that changes in the gut permeability, which are the tight junction dysfunction, may be responsible for a lot of the symptoms that are associated with these autoimmune conditions. As we saw earlier, the autoimmune conditions really affect a variety of different organs in the body. It can also cause something called leaky brain syndrome because, as we see on the picture here on the bottom, it can also cross the blood-brain barrier and affect the brain, the nervous central system, and a lot of other things. So very interesting topic. So microbiome and immunity, 70 to 80% of our immune cells are located in the gut. It's a very complex interactions between our immune system, our gut microbiome, as well as human pathogens. Some ways that and biomarkers we can look at to see how much inflammation are occurring in the body is the C-reactive protein, CRP. This tests the levels of C-reactive protein in the blood, which is a marker of inflammation. Your liver releases CRP into the bloodstream when there are inflammation present. Then we have a lot of GI testing, gastrointestinal testing, which tests the bacteria and all the microorganisms in a person's GI tract. And this test is very informative because it can give you an idea of what types of bacteria that are increased or decreased and how it relates to inflammation again. So yeah, and this table here shows a variety of different autoimmune diseases and how it relates to leaky gut symptoms and dysbiosis. We see on the right side characteristic of a dysbiosis. There's listed a variety of different bacteria, and the GI test will detect for the presence of this bacteria and see if there are an increased level of it or a decreased level of this. All right, so if everyone can write in the chat box, what do you think causes autoimmune conditions? Leaky gut, inflammation, diet and lifestyle, great answers, stress, toxins, poor diet, yes, lack of exercise, so many different factors, definitely not just one thing to blame. Yep, poor diet and stress. Great answers.
Awesome. Yeah, great job. People paying attention. Exactly. I like it how people are recognizing what you're talking about with leaky gut. This does have to do with the gut dysbiosis, which how do we get gut dysbiosis? It does have to do with nutrition and a lot of other factors. So what could cause the immune system to go on overdrive? There's many theories to what does cause an autoimmune condition. Many theories such as molecular mimicry, viral infections. So this is when our immune system really does go on overdrive. Our immune system is going to be attacking these molecules that look really, really similar to these viruses. Stress or trauma can trigger lots of inflammatory factors and just a whole cascade of an immune response. Also, like Frida was saying, leaky gut and intestinal dysbiosis, a sterile upbringing. Really interesting noticing if we were brought up in a home that constantly was spraying bleach and Lysol and antibacterial soaps all the time, it's kind of similarly to my patients with autoimmune conditions, because they were consistently on antibiotics for a very long time. This does affect the bacteria in our bodies and in our guts. That's going to be really important for our immune function. Also, exposure to toxins. So unfortunately, there's certain things we can and cannot control, and people who are just consistently exposed to toxins, whether that be pollutions in our air or our water, maybe it's pesticides in our food, maybe it's cigarette smoke and alcohol, these can all trigger an immune system response that could potentially trigger an autoimmune condition, especially if we're having the backbone, the foundation of a genetic situation where it's unfavorable. So the genetic component, did you know that females are at higher risk? Really interesting doing more research around this, because females are much more likely to get urinary tract infections. These infections, that molecular mimicry, this, whenever we're having a viral infection, it does have the potential to create that excessive immune response. So females are at a higher risk. Family history, some conditions like psoriasis can affect extended family members. And of course, if it's in your genetics, if your mother, your grandmother, sister, brother, if these people have an autoimmune condition, you are for sure more likely to develop one. Specific ethnic populations. Did you know that Jewish people of Jewish descent are more likely to have irritable bowel diseases? Also, people who are C-section babies, which isn't necessarily a genetic component, but that does have to do with our bacteria. Very interesting. That bacteria has to do with our risk of developing an autoimmune condition, and any sort of genetic mutations or existing autoimmunity. So if you have been diagnosed with type 1 diabetes, you're a lot more likely to have another autoimmune condition like arthritis or celiac disease, whether that be down the road or along with your diagnosis of that autoimmune condition. There are for sure different lifestyle factors that increase and decrease risk. Just like Frida was saying, the importance of our healthy gut. What makes our gut healthy, our gut microbiome healthy? It's fiber. So when we're taking in less than 25 grams of fiber every day, we're really increasing our risk of developing an autoimmune condition or a chronic disease. Also, adding toxins to our body, like smoking cigarettes, drinking alcohol, or undergoing chronic stress is a big one. If you work over 40 hours a week and are just constantly overworking, that's leading your body to really be on overdrive when it comes to, I think that a lot of people don't recognize that our sympathetic nervous system, our fight or flight response, does lead to an inflammatory response. It's really trying to get us to not necessarily process our food well, which, like Frida was saying, it could lead to intestinal dysbiosis and all these other things. So stress actually really does affect our risk for autoimmunity. And decreasing risk, on the flip side, consuming a nutrient-dense, fiber-rich diet, incorporating physical activity, staying informed. I put staying informed about medications. Did you know that a lot of medications do contain toxins? And especially mentioning antibacterial antibiotics, antibacterial medications, or even antibacterial mouthwash. These things can affect the bacteria in our bodies, right? Decreasing environmental toxins, purchasing organic, these things, they can all decrease our risk of an autoimmune condition. So when it comes to preventing with nutrition, I'm going to be going over antioxidants, essential fats, fiber, and elimination of trigger foods. And in one really interesting study, I used to work for Dr. Joel Furman. He did a case report study, and this case report had a few different people who were implemented with a nutrient-dense, plant-rich, plant-based diet as a protocol for people who were diagnosed with type 1 diabetes. And this research showed that the 3-year-old who was recently diagnosed with type 1 diabetes, if diagnosed early enough, when they were prescribed this nutrient-dense, plant-rich diet, that 3-year-old actually did not need to take exogenous insulin. That 3-year-old was actually able to reverse their autoimmunity. However, unfortunately, the people who are a little bit older, who implemented this nutrient-dense, plant-rich diet later in life, while they did not necessarily completely reverse the condition, like type 1 diabetes, most all type 1 diabetics, really, they need to be taking in some sort of outside source of insulin. Their pancreas simply is not able to produce insulin anymore. But of course, if we're eating a healthy diet that's nutrient dense, that's full of fiber, that's going to lead to less spikes and crashes of blood sugar, which is going to lead to much less complications with type 1 diabetes, of course. But it is really interesting to see these case studies. A lot more research is needed to see if we can actually reverse these conditions. One really interesting study about antioxidants was on acai. If you've heard of acai, it's kind of similar to a blueberry. It's this dark purple berry. Looking at implementation with acai on people with arthritis, as they, and over time, it's interesting, it took about 4 weeks to really see significant reduction in pain. The pain scores decreased as the antioxidant capacity increased. So antioxidants have been shown to really help reduce inflammation and improve these symptoms. And different spices like ginger, turmeric, rosemary, and clove were significant at reducing inflammation. And this was measured by TNF alpha. And if you've heard anything about TNF alpha, they do have different medications using TNF alpha. But I don't want to get into that. Basically, antioxidants are really, really powerful at protecting our immune system and reducing inflammation. And vitamin C, zinc, there's a lot of nutrients that act as antioxidants. And I highly, highly recommend, there's a lot more in depth I could go when it comes to antioxidants, which I went over in the cancer webinar. Cancer and autoimmunity, the recommendations often overlap because we're really just protecting our DNA from damage. We're protecting our cell membranes from damage and increasing our we're improving our immune system, right? So please do, if you have not already, watch the cancer webinar so that you can learn a lot more about antioxidants and more about how to implement those on a daily basis. Essential fats. This is probably the biggest thing that I educate my patients about when we first start working together. Most people will say, oh, I eat really healthily. I don't understand why, I'm having all this inflammation or whatever it is. And looking at their intake, sure, they'll take in the fruits and vegetables. Maybe they're eating plant-based, but they're not intentional about getting in essential fats. Essential fats are called essential for a reason. They really do help to decrease inflammation and improve our immune system function. So EPA omega-3s, they have been shown to really decrease pro-inflammatory molecules in rheumatoid arthritis. Also the pro-inflammatory, so oxylipins, these things that cause inflammation. In older subjects, research has shown that ground flaxseed, which is really high in omega-3 fatty acids, the ground flaxseed was able to significantly reduce this pro-inflammatory compound. So increasing omega-3s may reduce risk of a lot of different autoimmune conditions, but specifically the studies I mentioned here, helping a lot with arthritis, irritable bowel disease, and of course, in general, inflammation. So the big recommendations that we make to our patients at the Create Cures Foundation is getting in at least 2 to 4 tablespoons of omega-3 rich nuts and seeds, and making sure as well that if you're not comfortable with eating fish, there are algae-derived omega supplements that are fantastic as well. But we recommend 4 ounces twice a week of low mercury wild-caught fish using the acronym SMASH. So that's sardines, mackerel, anchovies, salmon, or herring. It's just 4 ounces twice a week to really make sure that we're getting our EPA, DHA essential fats. Okay. All right, everybody, opening up your chat box, please. What foods contain fiber? Do eggs contain fiber? Do Oreos contain fiber? What foods contain fiber? Legumes, fruits, greens, yes, nuts, fruits, plant-based foods, vegetables, oats, fruits, nuts, legumes. Yes, I love people saying like oats, right? Whole grains for sure, grains, plants. Yeah, exactly. Plant foods contain fiber. So what is fiber? It is that cell wall that exists in plant cells, right? Animal cells don't have a cell wall. Animal cells like from eggs, cheese, meat, dairy, that doesn't contain any fiber. The fiber is in that plant matter. So does orange juice, when it doesn't have any pulp, Orange juice, even though it comes from a fruit, it doesn't have any fiber because all the fiber has been taken away, right? An apple has all that pectin in the skin that has fiber, but apple juice does not, okay? Grains can irritate some people's guts. Yeah, we're going to get into that in a little bit. When it comes to prebiotics, probiotics, and fiber, fiber is truly the most essential nutrient that a lot of people probably aren't prioritizing. It is the beneficial bacteria, it is what feeds our beneficial bacteria. So all of the healthy microbiome, the healthy microbiota in our gut, it's not going to be able to survive. It's not going to thrive if we're not taking in enough fiber, especially different types of fiber. So different foods to make sure you're including, yes, the grains, the vegetables. Specifically, I want to recommend everybody go to the store and buy a Jerusalem artichoke. It tastes like a potato, and potatoes are great as well when it comes to that resistant starch. But Jerusalem artichoke and chicory root, they contain that prebiotic fiber called inulin, which has been shown to really help promote healthy gut microbiota. Also different types of greens and garlic and onions, asparagus, bananas, oats, cacao powder. Cacao powder, I remember doing in my cancer research, doing my master's, it has antioxidants and compounds that are released in our gut later on. So the fibers in cacao are really amazing. Also apples, ground flax, wheat bran. These are all lots of different types of fiber. And thinking about oats, how that's that kind of slimy soluble fiber, oats and ground flax and chia seeds versus like raw carrots, there's lots of different types of fiber, and these are all going to be really important to build that healthy bacteria in our gut. Whereas probiotics, they're like a raindrop in a swimming pool when it comes to really benefiting your gut. What's going to be the most important is taking in more fiber. But taking probiotics can help as well. And you can take supplements or eating things like sauerkraut, plant-based yogurts, make sure it's unsweetened. Tempeh, miso, kombucha, there's a lot of different types of fermented foods that contain beneficial bacteria that when you eat it, it can be helpful. Clinical applications. All right. So did you know that there's something called a fecal transplant that has been really well researched in people with irritable bowel diseases? So when it comes to high fiber intake and making sure our gut is healthy, for people who are really, really struggling with irritable bowel diseases, a fecal transplant, getting somebody with really, really healthy microbiome and using a enema to transplant that microbiome, that's been shown to be super helpful. And actually, my sister has ulcerative colitis, which is an irritable bowel disease. She's of Jewish descent, C-section baby, probably stressed out college years, eating pizza, not enough fiber. And she does have irritable bowel disease, ulcerative colitis. Something that really, really, really significantly helped her was a fecal transplant. So noticing that, oh my goodness, if we're able to really, really significantly reduce symptoms and get somebody into remission with this transplantation of microbiota, maybe instead of having it come down to that, we can make sure we're getting enough fiber, make sure that, yeah, we're taking in some fermented foods. That's really, really, really important. All right.
Great. Thank you, Katie, for sharing the personal story and all the great nutrition interventions. So to review, where is most of our immune system found? The gut. Awesome. The gut. Great. And then leading into the next topics we're going to talk about, we have another question. What foods could cause leaky gut? Any ideas of any trigger foods that could cause inflammation? Lectins, glyphosate, processed foods, red meat, sugar, flour, salt. Yep, gluten. Yes, definitely going to talk about gluten. Great. A lot of different triggers, as we can see. And gluten, as some of you were mentioning, definitely a big trigger for a lot of people. Before I talk about all these different nutrients that may be a trigger symptom, I want to also emphasize that it's very individualized. So although we mentioned certain foods now that may trigger inflammation, this does not definitely not apply to everyone. I will be describing the reasons behind why it may cause some inflammation. So first of all, we have gluten. That's a popular topic. Gluten is a protein that is found in wheat, barley, and rye. It's also found in a lot of sauces and soups. It's used as a thickening agent. So it's also found in a lot of food that we may be surprised we can find it in as well. Gluten consists of two main proteins called gliadin and glutenin. And for those suffering from GI disorders such as inflammatory bowel disease, celiac disease, this could really be a problem. So when gliadin, which is the main cause of the inflammation from gluten, interacts with a particular receptor, which is called CXCR3 within the GI tract, when this interact, the GI cells will actually produce and release a protein called zonulin. And this zonulin then reacts with the GI cells that causes the gut-tight junctions that I was showing on the a picture previously to grow wider. So remember the space between them, or in the gut, we want it to be not too far away from each other, because then things that are not supposed to flow through it will flow through. So when this inflammation is happening, the tight junctions will grow wider, and this causes this molecule to go through and can therefore cause inflammation. Dairy contains the protein casein, and this casein is the main protein that is found in milk as well as other dairy products. And this can also be a trigger for inflammation for some individuals. Casein has actually a very similar structure to gliadin. So you can imagine it's a very similar structure. So it also is responsible for a lot of the gluten sensitivity individuals. In fact, up to 50% of people who are sensitive to gluten are also sensitive to casein, which makes sense because it's such a similarity in their structure. We have nightshade. Some people, this can be very hard to digest for certain people. It also contains lectins. Again, could be hard to digest for certain individuals. Sugar, alcohol, processed foods, we know all of these things are bad for us, causes inflammation as well in our bodies. All right, and then so one study by Choi and others found that certain fasting mimicking intervention can also help with certain autoimmune symptoms. So for example, this study here showed that a periodic 3-day cycles of a fasting mimicking diet was effective in decreasing or enhancing the demyelination and symptoms in mice with multiple sclerosis. And it showed that it really promoted regeneration and reduces the autoimmune in mice. In fact, it completely reversed the symptoms of 30% of the mice. Again, this is mice, so it's always different in humans. However, another randomized pilot trial that assessed the health-related quality of life in relapsing remitting multiple sclerosis patients. Again, this was a pilot trial. 20 individuals in the control diet, 20 individuals in the fasting mimicking diet, and then 20 individuals in the ketogenic diet. And the studies show that the individuals who were in the fasting mimicking diet and the ketogenic diet had significant clinical improvements in the quality of life at 3 months. I believe, and I think these studies show significant data and results, and in the future, when we have more randomized clinical trials, they should also be looking at MRI and immune assays to get a more comprehensive understanding of the impact that fasting and nutrition intervention can have on all these symptoms.
Thank you, Frida. Yes, and then some takeaways from today. As far as making it so that this fasting can be sustainable, we can get benefit from a 12 to 14 hour overnight fast. So we recommend here at the Create Cures Foundation, try to eat your last bite of food about 3 hours before going to bed. And then between your last bite of food in the evening and your first bite of food in the morning, wait 12 to 14 hours, okay? watch our cancer webinar. We do go over a little bit more in detail with different things that overlap with recommendations from what we talked about today. And this plant-based longevity diet, making sure that your plates, your meals are full of vegetables and quality carbohydrates, having those antioxidant berries, those essential fats, and the smash fish, sardines, mackerel, anchovies, salmon, and herring, making sure it's wild caught. And then nuts, seeds, olives, avocados, right? Getting in those essential fats. Using moist heat cooking methods, improving our immune system means making it so that we're not taking in a bunch of artificial flavors and colors and baked goods and things that are cooked at a really, really high heat. They could be denatured and they're not going to be as nutritious. So using moist heat cooking methods, getting in those sources of fiber, lots of different types of plant foods, whole grains, fantastic. Getting in those quality carbohydrates. Who eats oatmeal every day? Shout out to oatmeal. Also, stress management and adequate sleep are going to be extremely, extremely important for managing any autoimmune condition, any chronic disease, and making it so that we're preventing diseases long term. Also, it's going to be really, really, I think, important to talk about. I've noticed some people in the chat box, something that we do recommend at the Create Cures Foundation to make sure we have an individualized approach is a test to see what bacteria is in your gut and what foods are causing you inflammation, what foods are you maybe having an allergic response to or an inflammatory response to. And there's a few different types of tests that are out there that we recommend on an individual basis. So it's really, really important to meet one-on-one with a dietitian so that you can see, okay, do I need to avoid nightshades? Maybe you need a specific carbohydrate diet. I know a specific carbohydrate diet, SCD, that really helped my sister with ulcerative colitis and irritable bowel disease. So these different types of diets, we don't want you to just only eat, you know, lettuce, breakfast, lunch, and dinner because you're afraid of an immune response. There are tests that you can do to be at peace and to maybe remove certain foods for a certain period of time. And then we can help you slowly implement those again and retest. And I love, I have a few arthritis patients and autoimmune patients who, since working with me and since getting tested, they've really improved their symptoms and really, really drastically improved. And it's really fulfilling. So yeah. Okay. Everybody opening up your chat box here. What is one food that you're going to include to help decrease your risk of autoimmunity? We talked about, more fermented foods. Yes, ground flax. I love saying flax. The whole flax seeds are great fiber, but ground flax, you're really going to absorb those omega-3s. Avocados, leafy greens, turmeric, nice. The Jerusalem artichoke or sunchokes, yes, such a good source of that inulin, that prebiotic fiber. Prebiotics and veg, amazing. You all were paying such great attention. Low mercury wild caught fish, amazing. Plant-based diet and some kombucha. Beautiful. I hope you all do really implement these.
Awesome. So what is one food that you're going to avoid to help decrease the risk of autoimmunity? We have so many foods that will prevent or help decrease the risk of autoimmune immunity, but there's also many that could, that you really want to avoid. Gluten, packaged foods, yes, that consists of a lot of processed stuff. Emulsifiers, yes, that's another one. Alcohol, sugar, great.
Awesome. And when it comes to gluten, as Frida mentioned, this is on an individualized approach. Some people are actually totally fine eating gluten. So it's a good idea to get these tests done and meet with your registered dietitian. And one more quiz question here. What is one health promoting behavior? What is one action step you're going to do to decrease risk of autoimmunity? Better sleep, relax, gratitude, exercise, sleep. Yes, exactly. So when it comes to eating healthier, it's not just about eating salad all day long. Yes, laughter. We do talk with all of our patients about a holistic approach. Hey, are you taking time to relax? Are you taking time to laugh? How is your sleep? This is all very important. Amazing. Great job, everybody. Avoid men. You all are funny.
All right, so before we have Q&A, I want to say that this was the 7th session of our longevity diet webinar series. We are going to have a holiday special right before Thanksgiving. We haven't decided yet, but we will inform you in our newsletter, the date, and we will be going over a lot of tips and tricks, how to stay on track, but still relax, have a great time during the holidays. So I'm very excited for that one.
And a reminder, 30% off using the code autoimmunity 2022. This expires November 26, 2022. And I really recommend that people take advantage of this. I don't want to see you stressing out, feeling like you need to avoid all these foods. It's a good idea to meet with a dietitian so that you do feel grounded, excited about steps moving forward. And that longevity masterclass, this is an incredible masterclass, no code yet necessary. And this expires November 26th as well. Okay. And now it's time for questions. So Frida, if you'd like to start off answering a question from the Q&A box.
Yeah, absolutely. So I see a question. Any suggestions on how to identify food that triggers or identify food triggers such as nightshades? So for example, if a person have a delayed reaction with the food, how would you figure that out? So that's a great question to ask. That's where I would recommend something called like elimination diet, or eliminate a certain food at a time, or remove nightshades, see how you feel, and then you reintroduce one at a time. And then you will see, so let's say you remove all nightshades for a couple of weeks, and then you do have, for example, peppers, only peppers, none of the other nightshades. And then you see if you react, and then also keep a food log of how you react to that. That will be my recommendation.
Awesome. Yes. Thank you, Frida. I see a question here. Does coffee or coffee grounds have fiber? While coffee does not have fiber, if something is totally liquid and there's no pulp in there, then there's no fiber in there, right? Whenever you're juicing something and straining out the pulp, you're straining out the fiber. So coffee itself does not have fiber, but if you add the coffee grounds, I've seen recipes for zero waste coffee ground muffins or coffee ground pancakes. If you do throw the coffee grounds into something that you're making, that does add fiber. So the coffee grounds themselves adds fiber. And there are beneficial polyphenols and antioxidants in coffee that can really help your immune system function, especially if you are a fast metabolizer of caffeine. So yeah, coffee doesn't have fiber, coffee grounds does.
There's a question about best dose of zinc. Zinc is found in a lot of seafood and poultry as well as meat. It's also found in whole grains and legumes. So there's so many different great plant sources as well as seafood that you can get zinc from.
Yeah,
No, go ahead, Katie.
Yeah, when it comes to zinc, this is something that I've noticed a lot of my patients will say like, oh, I'm nervous about this nutrient. And then tracking their intake, they're actually getting plenty. So it's a good idea to work with a dietitian to see like, what nutrients do I actually need to be worried about? And we can help you find sources that you really enjoy and help you come up with recipes into your repertoire that are simple and easy. Yeah, that's all I wanted to say. I see another question. Did you want to add to that?
No, not on that topic. Go ahead on the next question.
Okay, I see a question that asks vegan options for smash fish. So I can go back to that slide, actually. Let me see. These 4 sources, the ground flax, soaked chia, walnuts, and hemp seeds, 2 to 4 tablespoons. Although it does vary from person to person, your capacity to absorb and make those DHA, those long chain fatty acids from the plant-based sources, recommend getting those in most days. And there are algae derived omega supplements that are fantastic. And I have a Consumer Labs third-party testing site subscription where I go on there and I see, okay, what algae derived omega supplements are actually what they say they are. A lot of supplements out there, they're not well regulated. So I really like my third-party testing site so I can tell my patients, okay, these ones are the approved products. I don't really like to just buy any cheap supplement. So yeah, I recommend most days of the week an algae-derived omega supplement, and then making sure you're taking in one of these four sources of plant-based omega-3s on the daily, or at least most days.
Great, thank you for sharing that resource, Katie. I see also a question, there's a question about, I see alcohol on the list, but I've also heard that a glass of red wine is healthy. So the whole conversation about wine and alcohol, it's a little more complex. And also nowadays we see a lot of recommendation with the Mediterranean diet, like, oh, the resveratrol, which is a phytonutrients found in the skin of grapes. I would say you will get more benefits if you eat the grapes rather than the wine. To get the same benefits of the resveratrol from wine, you have to drink an excessive amount, and the harm outweighs far than the benefits of the resveratrol in just one glass of wine. So that also has to do with, like, you want to have balance, you want to not feel restricted. So it's more complex. That's why we always recommend, again, to see a dietitian so we can see what's most realistic for you, what's your history with alcohol, and these factors.
Definitely. Yeah, thank you, Frida. I know alcohol is such a topic of that people have their opinions about, but the vast majority of research shows that decreasing alcohol is going to really help improve our immune system. I think you explained that really, really well. I see a question here for the stat on the 12 to 19-year-olds. What was the time frame? And I want to bring that up. This is so interesting. So the 12 to 19-year-olds increased nearly threefold over the study period. This was published in 2020, and this was a long time frame. It started in 1988, right? So these different time periods, they were able to observe exponential, like crazy increase in the prevalence of these antibodies that are directly linked with autoimmunity. Okay.
There's a question there. Is there a link between leaky brain and dementia? Great question. So leaky brain will happen from a leaky gut. So when a leaky gut happens, there's a lot of inflammation going on, which then can get also into the brain, with, among other organs. I've definitely seen research that inflammation is a big part of dementia. So it's definitely a big risk factors for a lot of neurological conditions as well as dementia. But again, it's not just one factor that would cause it. So it's very complex, of course.
Right. Yeah, that's a really interesting with dementia. Is it an autoimmune condition, or is it, what really causes dementia?
Yeah, so much exciting research around that topic and Alzheimer's disease these days.
It's really interesting. I see a question that says quinoa and rheumatoid arthritis, question mark. Quinoa is one of the grains that I recommend most often. It's really high in iron and plant-based protein and fiber. Quinoa is fantastic. Quinoa also, in general, for most people, seems to be really well tolerated, even in people who are who can't tolerate gluten, who can't tolerate other grains. Quinoa seems to be really gentle. But with all grains, I think it's a good idea, especially if you have an autoimmune condition, it's a good idea to cook it properly. So soak your quinoa, rinse it, make sure it's cooked well, boil it, and rinse it off first and soak it for, I would say, since quinoa is so small, soak it for about 4 to 6 hours and then boil it or pressure cook it. When it comes to removing anti-nutrients or things that may cause inflammation, just like in an apple, it's really designed to have these anti-nutrients in the seed so that the seed will come out intact in the other end, and those nutrients won't be released until it's in the ground. And all of these grains, like whole wheat and quinoa, these are seeds of a grass. Like brown rice, it's a seed of a grass. And the anti-nutrients won't be released until it's put in the ground and sprouted. So once things are sprouted, then those anti-nutrients are released and we're able to absorb them. So how do we mimic that? Is we can soak and sprout our grains before we cook them. Boiling removes 90% of the anti-nutrients, which should be fine for most people, but to really remove almost 100% of those anti-nutrients, maybe with the quinoa, soaking it and rinsing it and then cooking it can really help to make sure you're not going to have an immune response or an inflammatory response.
I also wanted to add that quinoa and oats are naturally gluten-free. So, however, sometimes there can be cross-contamination from, like in the factory, it's made with other types of wheat. So it's still important, if you are following a gluten-free diet, that it's indicated on the label. But other than that, that's also why, as Katie mentioned, quinoa is such a great option also for people who are sensitive to gluten because it's gluten-free. So that's great.
Yeah. I see another question. Does excessive essential fat intake cause diabetes? Definitely. Excessive intake in general could lead to a lot of chronic diseases. So whenever anything is excessive, that's not going to be healthy. It's important that when we're taking in especially excessive fat sources tend to be lower in fiber. Fat sources take longer to break down, and maybe we're going to feel lethargic, right? So yeah, I would say that as far as diabetes goes, we don't want to have an excessive intake. And to help with that, working with one of us, we really are able to recommend a certain amount of food and help you log your food and help you see what portion sizes work well so that you're not overeating. A lot of people, when they first start working with us, they're not realizing that they're overeating at each meal. And that can cause blood sugar spikes, even if it is healthy food. Okay. I see this question. What tests do you recommend to get to the bottom of fatigue or constant lethargy? My daughter lives in chronic stress and has had complete blood count back, which is showing high white blood cell count. So this is something that is really individualized, and for sure take advantage of this promotion we have going on, so that, it's going to be hard to answer really quickly. But I'm glad that she has a blood test back. Usually, especially in young women, fatigue is related to low iron. That's really, really common. Women need twice as much iron than men. And if they're eating a healthy plant-based diet, sometimes they're not being actually healthy about it. Sometimes they're not being intentional about getting in enough iron. So when it comes to white blood cell count, yeah, I'm curious. I need to learn more of what's going on.
It looks like we got through most of the questions. If there are questions we didn't get through, we will get back to you through email.
Okay. Yeah, thank you everybody for coming, for taking the time, for engaging with us on here. I really hope you got a lot out of this.
And please be on a lookout for our next webinar, the holiday special.
Yes. Yeah, we have a holiday special next month. This is going to be going over a lot about mindset and navigating, continuing to eat healthy throughout the holidays. So I hope to see you there. Thank you all so much.
Thank you, everyone.